Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. I have been a cardiologist for more than 40 years at the Texas Medical Center in Houston. And today I'm going to talk about your cholesterol, what you need to know, and what you should be doing. As you know, cholesterol is the number one risk factor for heart disease. There are various forms of cholesterol circulating in your body, and we're going to cover every aspect of cholesterol you need to know and also things that you were afraid to ask. Starting off with basics, what makes the total cholesterol? We talk about the total cholesterol, LDL, HDL, and VLDL or triglycerides. Total cholesterol includes the LDL, which is the bad cholesterol, the HDL, which is the good cholesterol that removes the plaque and the cholesterol from the arterial linings and brings it back to the blood circulation and eventually to the liver to be broken down. Then we have triglycerides. Triglycerides are fatty acids which are produced in the body when we eat a lot of carbohydrates or fat, and these triglycerides are eventually converted into long chain fatty acids which go on to be converted into cholesterol, HDL and LDL forms. The LDL is the one that causes most of the heart problem that we know of. As you can see, the HDL is the bad cholesterol, which is deposited inside the arterial linings, giving rise to a plaque like a mountain, which blocks off the artery, leading to reduced circulation, heart attack, heart failure, irregular heart rhythms, and all the other complications related to the coronary artery. The heart is supplied by two coronary arteries, namely the right and the left coronary artery. And when these arteries get blocked off by these cholesterol deposits, along with platelets and fibrins and monocytes, along with calcification, it builds up like a mount, eventually leading to a progressive narrowing. In patients with heart attack, it may be totally blocked off. That's why it is important to make sure that we keep our LDL level low. On the other hand, the HDL, the good cholesterol, removes this cholesterol plaque from the arterial linings and thus sort of counterbalances the bad effects of the LDL cholesterol. And you would like to have a high level of HDL, which is a real challenge. We'll talk about that when we come to the management of cholesterol levels. So this is the basic concept of LDL cholesterol, the bad guy, and the HDL cholesterol, which is the good gal. And here is the story of how a plaque builds up and how cholesterol interacts in different manners. Okay, let's talk about what are the normal cholesterol levels. What should be the normal cholesterol levels? Okay, let's see. Okay. The normal adult total cholesterol should be below 200 milligram per 100 ml of blood. In children, it can be 170. Any cholesterol level above 240 milligrams per 100 ml is considered abnormal. It's considered something that needs further evaluation. It considers maybe risk factor modifications and medications depending upon the composite risk factors in each given individual patient. Of course, there's a direct correlation between total cholesterol and heart disease. If the cholesterol level goes from 200 to 250, that is 50 points, the risk of heart disease goes up by 100%. So every milligram of cholesterol increases the heart risk by 2%. As a result, you will end up having twice the risk of heart attack if your cholesterol goes from 200 to 250. Keep that in mind. By the same token, if you decrease the cholesterol level from 250 to 200, your risk is reduced by 50%. Not 100%. I mean, you start off with this one, you reduce it by half, which is 50%. LDL cholesterol and atherosclerosis. I just already talked to you about what the LDL does. LDL is the cholesterol. These are small particles which get into the arterial lumen and build up as a plaque along with proliferation of the lining of the arterial vessels with deposition of platelets, fibrin, monocytes, all of this causing a blockage. These LDL particles infiltrate the arterial walls, triggering not only acting as a mass, but also trigger inflammation. When there's inflammation, then you get inflammatory cells coming in, which leads to inflammation, scarring, fibrosis, that leads to hardening of the arteries and eventual blockage. That's why over time, there is narrowing of the arteries, increasing the risk of heart attack and strokes. And here's a very good example of an artery that is showing significant blockage, almost like 90% blockage with deposition of this yellow fatty material, which is the LDL cholesterol, along with many other things like proliferation of the smooth muscle cells, along with platelets, fibrins, monocytes. All of these build up like a mount inside the arterial lumen all the way around. That leads to blockage. Okay, what is the ideal LDL, the bad cholesterol level? Usually the LDL is between 130 to 150 milligram percent in a person who has never been treated. When the cholesterol is 200, you expect the LDL to be around 130. But in most adults, the standard recommendation today is to have your LDL below 70 milligram per 100 ml of blood. However, if you have multiple risk factors like diabetes or history of stroke, history of heart attack, history of coronary artery disease, when you have all these conditions, they expect your LDL level to be below 70 milligram percent. How can we control cholesterol level? After all, what you eat is what your body is and what you are. So as a result, if you eat too much cholesterol, you're going to have more cholesterol in your circulation and more cholesterol deposition in the arteries. That's just one aspect of a whole multifactorial effects of cholesterol related to risk factors like hypertension, diabetes, heart disease, high obesity, along with genetic factors. But the important thing is to first get your cholesterol levels, total cholesterol level, LDL, HDL, triglycerides, and combine that with all the risk factors you may have, obesity, family history of heart disease, hypertension, diabetes. When you put all these things together, then we come up with a composite plan as what is our target level. I mean, that is the bottom line. What we want the total cholesterol to be. Should it be 200? Should it be 160? And what the LDL should be. Should the LDL be 100? Should it be 70? Some cardiologists even recommend to bring the LDL down to 40 milligrams in patients with very high risk heart disease. So this is something that only your cardiologist can determine based upon your multitude of factors that interplay in the formation of your heart disease. How can we control LDL? LDL, majority of it comes from the diet. It is also manufactured by your liver inside the body. When you supply excessive raw materials like triglycerides and cholesterol, it's going to convert them into LDL particles. So the best thing to do would be to keep your cholesterol level down. Let me give an example. An egg contains 274 milligrams of cholesterol. The daily recommended cholesterol is less than 300 milligram percent through the diet. So I would say if you're going to be eating eggs, you can use the egg substitutes, or better yet, minimize the use of eggs to maybe 2 eggs or 3 eggs a week rather than taking 3 eggs daily, because you're getting triple the dose of cholesterol in your diet, which is obviously going to increase your total cholesterol level. That is, reducing the fat intake will also help to lower the cholesterol. Reducing like meat, which has a lot of saturated fat, or using a lot of saturated fat like butter or margarine. Cutting all these things will help to lower the LDL level. That's from a diet perspective. When you exercise, your LDL level comes down. That's another important thing. And foods such as oat, beans also help to reduce the amount of fat available for absorption. As a result, it will reduce the total cholesterol and also the LDL cholesterol. Of course, the first line of treatment for patients with high LDL levels, like 150 or 200 or 250, the first line of treatment is, of course, the statins, which most of you have heard, like atorvastatin, rosuvastatin, pravastatin. All these statins are the drugs which lower the production of LDL in the body, and they are very effective. As a matter of fact, they can reduce your total LDL cholesterol by almost 40 to 50%. But they also have side effects, which we're going to talk about. Then we have the new medications known as the PCSK9 inhibitors, which are used in advanced cases where patients can't tolerate statins, where they have significant coronary artery disease, heart failure, and all the complications from the heart artery blockages. And those are the candidates who may be benefiting from that PCSK9. We'll talk about the dosages in a minute. Now let's talk about the HDL cholesterol. We said the LDL is a bad cholesterol. What we need to do in terms of reducing the LDL level with the diet, with exercise, and medications. HDL, I said, is a good cholesterol. Well, if the good cholesterol is good, why not we increase the good cholesterol so that we reduce the risk of heart disease? That's an excellent idea. I tell you, I think everybody in the world would be benefited if we can just dramatically increase the HDL like a magic. But it doesn't happen like a magic because HDL is very, very difficult to increase in our body because it is produced in smaller amounts compared to LDL, and HDL is something that doesn't change dramatically with any kind of treatment. Of course, the statins do increase the HDL level. The normal HDL should be 40 milligram percent or greater. And there are a few things that can increase the HDL level. Alcohol increases HDL level, but it's not the kind of HDL that removes the cholesterol from the arterial plaque. So don't go on binging thinking that alcohol will increase the HDL level. That is not the right way to do it. As I said, the statins do help. This one, diet, cutting down high cholesterol diet will help to improve your HDL level. Weight reduction will dramatically help to bring your HDL level down. Exercise is the only thing that has been shown to reduce the HDL level. To increase the HDL level to a reasonable level. If your level is 40 and if you increase it by 10%, it will only go to 44% from 40. So it's not going to be a dramatic change, but any positive direction change is welcomed. So that's something we need to keep in mind. People who have a HDL level of greater than 60 milligram per deciliter are supposed to have low risk of heart disease. This is genetic. In Indian population, majority of the people have lower HDL levels in the range of like 25 to 40 or less. Whereas there are some other groups where the HDL level is like 60, 70, 80, and they have the lowest incidence of heart disease. So the things that we can do to improve HDL level is our diet, weight control, sugar control, and also modification of risk factors and exercise. Keep these things in mind. That will help you to become a better patient dealing with HDL. So for men, it should be the goal of treatment is to what is low HDL. Anything below 40 is considered low for men, below 50 is considered low for women, and it It is seen in patients with the so-called metabolic syndrome. People who have like little blood sugar, people who have low cholesterol levels, I mean high LDL levels, along with low HDL levels. 30 minutes of exercise daily, as I said, will help you to boost your cholesterol level, HDL level. Then, by replacing refined carbs with healthy fats, avocados, nuts, quitting smoking, and using nuts will help to improve the good cholesterol level. Now, let's move on to the third factor in the total cholesterol that we talked about, namely the triglycerides or the fatty acids. If you eat a lot of carbohydrates or a lot of fatty food, all that fat is broken down in the stomach and in the GI tract into smaller particles that the body can easily absorb. And these are known as the triglycerides. That's like a 3 fatty acid chain molecules. And the triglycerides are also an independent risk factor for heart disease. So the total triglyceride should be less than 200 milligram, and anything more than 200 is supposed to increase the heart disease risk, even if the LDL and HDL levels are within normal range. And we see these high levels of triglycerides in people who binge on carbohydrates, people who are obese, people who have diabetes mellitus. They run triglycerides in like 300, 500 milligram percent. And that's not only increases the risk of heart disease, but also increases the risk of pancreatitis. That's a more serious condition, which is an acute one, which can be treated, but we need to bring the triglyceride levels down dramatically to minimize the risk of pancreatitis, which can be sometimes very, very high risk. How can we lower the triglyceride levels? Basically, as I said, reducing alcohol intake, reducing carbohydrates, and reducing refined foods, increasing the fiber in the diet, increasing the omega-3 rich fatty acids like salmon, mackerel will help to lower the triglyceride levels. The key is the quantity. Most of your extra high levels of triglycerides come from fat and, more importantly, carbohydrates. Especially if you have diabetes, since your body cannot mobilize that glucose, eventually it's going to be converted into triglycerides, which is going to be deposited into your body as fat, and which acts as another risk factor leading to obesity. The medications that are available to reduce the triglyceride levels are very effective. They can reduce the triglyceride levels by almost 50-60%. But the more important part on your side is to modify your lifestyle, your diet, and get engaged in an exercise, which will all help to lower your triglyceride levels. Fenofibrates are one of the main drugs used to lower the triglyceride levels. Like fenofibrate can lower the cholesterol by more than 50%. And same thing, high doses of omega-3 fatty acid supplements also reduce the triglyceride levels. Hyperlipidemia, you hear this term. What is hyperlipidemia? Hyperlipidemia means high cholesterol levels. It could be triglycerides, it could be LDL, or it could be low HDL. So we start off with the diet. How do we manage this? Lifestyle changes are the most important thing, because all these drugs have side effects and you have to take them lifelong. So the best way is to minimize the risks to start with. That is, prevention is better than cure. So your diet has to include whole grains, vegetables, salads, plant-based proteins, which are less in amount of fat, saturated fat, and cholesterol. And exercise 150 minutes per week. Moderate amount of exercise will be very important and crucial part of management of your cholesterol levels, overall your heart disease level, diabetes, obesity, hypertension. All of these can be modified with your diet and exercise. The key foods that you should consider to lower the cholesterol level would include oats, barley, beans, soluble fiber. They have soluble fiber, fatty fish, omega-3 fatty acids, nuts and oils, which are also having healthy fats. When do you need medications? If your LDL level is greater than 190 milligram percent, despite diet, exercise, lifestyle modifications, and all the other things that you have tried, then you're going to need medications. On the other hand, if you have a history of diabetes, if you have history of stroke, if you have history of heart disease, your LDL level should be less than 100 milligram percent. Or if you have a bypass surgery or a stent, most cardiologists would recommend that you get your level below 70 milligram percent. And also, same thing applies in patients with diabetes mellitus. What about the supplements? Psyllium fibers do help. 4 grams per day will help to lower LDL level, but also psyllium may interfere with your medications in absorption. Psyllium may also cause gas, and some people may feel bloating, so that's something you want to be aware of. Plant sterols, 2 grams per day, may reduce LDL by. All these supplemental things can reduce your LDL by like 5%, 10%, 15%. They are not as dramatic as the statins. So that's the thing you want to keep in mind. Also, you want to keep the cost plus side effects. As I said, psyllium fiber is great if you can tolerate it, but it can cause bloating. It can also cause changes in bowel movements. And more importantly, it may interfere with your important heart medications. Absorption. Are cholesterol level targets different for women? Yes. In women, need higher HDL level. For men, it was more than 40. For women, the HDL has to be more than 50. The LDL levels are about the same in the female population. How do we manage cholesterol in children? Some children who are born with high cholesterol levels, high triglyceride levels, we first focus on diet by limiting sugary products, limiting fried food, and we really do need to use medications unless they have a genetic form of very high LDL levels in the form of like 1000 milligram percent, and those patients may need medications. Can skinny people have high cholesterol levels? You bet they can. Yes, if they have a genetic predisposition for high cholesterol and heart disease. I had people who were like weighing 100 pounds who had heart surgery. So heart disease is not protected by having skinny body texture, body stature. So remember that it's your genetics and your lifestyles that determine what your cholesterol levels are, and cholesterol levels have a direct relationship to the heart disease. So you need to keep that in mind. So let's move on to, does cholesterol level really matter? If I'm feeling fine, I'm not having any symptoms, why do I have to take all these medications with, horrendous side effects and all this? Yes, I understand your point. But remember, cholesterol, like high blood pressure, all these things, these are silent killers. If you don't take care of them over a period of, years and decades, they cause major serious side effects like heart attack, stroke, heart failure. So prevention is the best cure when it comes to chronic diseases like heart disease, diabetes, high blood pressure, and risk of stroke. So definitely, if you're high cholesterol, you need to take lifestyle modifications and some medications if needed, so that you can minimize the risk of having subsequent heart attacks or increase the duration before you have any kind of symptoms. But it will also help to kind of heal the old plaques that are built up by gradually reducing the cholesterol level and increasing the HDL level, because that will give time for the arteries to kind of repair itself. Can HDL reverse plaque? In animal studies, it has been shown that HDL promotes plaque regression by removing the cholesterol, the LDL cholesterol, and reducing the inflammation. As I told you, the LDL cholesterol not only it acts like a mass inside a plaque, but it also stimulates inflammation. So by reducing the amount of LDL inside the plaque, you reduce the chances of inflammation. What is the next breakthrough available in the management of patients with high cholesterol who can't tolerate statins, who can't tolerate any other medications, but they have coronary artery disease, they had bypass surgery? What's available? And here is, as I was telling you, an RNA-based drug that is PCSK9 inhibitor that reduces the LDL by almost 50%. As I said, it is reserved for patients who are at the highest risk and patients who cannot tolerate any other medications. Statins, they reduce the cholesterol level by 30 to 50%. They inhibit the enzyme HMG-CoA reductase, which blocks the cholesterol production in the liver. And that's as far as LDL medication is concerned, the statins, how they work. And they reduce the cholesterol by 30 to 50%, and they reduce the risk of heart disease significantly. The major side effects of statins are, of course, muscle pain, weakness, which is seen in about 7 to 29% of the patients, but generally they are sort of not crippling. You have them, and sometimes you may get over them. If not, maybe change to a different brand or maybe reduce their dosage. There are some stomach side effects like nausea, constipation, but they generally are not sort of debilitating or force you to stop the medications. There is a 9% increased risk of diabetes in susceptible patients who are on statins, and there's some memory confusion which may reverse after stopping the medications. There's another you need a follow-up, like every 6 months you need a blood test, because the statins have an effect on the liver. They affect liver enzymes, and so to one, assess the cholesterol levels. Number two, to assess the liver function, you need to get a blood test done every 6 months so that your family doctor can follow these and see how the medications are working. Are you having any side effects? And there's another side effect that we have with statins is the skeletal muscle pain we were talking about. Sometimes the skeletal muscles can get inflamed, and there's sudden release of a lot of enzymes, the CK from the skeletal muscles, which can be sometimes very serious. That's why doing blood tests will help us to keep track of what is happening with all these medications and how your body is responding in terms of lowering cholesterol and showing any signs of side effects. Creatine kinase is a muscle enzyme that is released in patients who have severe reaction to the muscle pains, and that can be sometimes counteracted by giving their patients with coenzyme Q10, which may be helpful in patients with a lot of muscle cramps. That's a symptomatic relief. I want to talk to you about another cholesterol which was not covered in all these other topics. That's known as the lipoprotein little a, or LPA. LPA is another form of LDL cholesterol, which is more serious than the regular LDL in terms of causing heart disease. This was discovered in 1963, and it combines the LDL particle with another chain of phospholipids known as the apolipoprotein A, and this combination is called as LP little a or alpha lipoprotein little a. And those patients who have higher levels of uh, LP little a have a much higher incidence of heart disease. And surprisingly, the Indian population has a much higher levels of this LP little a, which consists of, here's a regular LDL, which has a core of cholesterol and these lipoproteins, whereas this LP little a has a side chain which is attached to, which is little a attached to ApoB. This is ApoA, ApoB. So the LDL has only ApoB, whereas LP little a has a side chain of phospholipids, which is attached to that. And this is highly serious in terms of causing heart disease. It carries this cholesterol into the arterial lining, thus increasing more deposition of LDL cholesterol, leading to inflammation and calcification. Okay, the normal level should be less than 30 milligram per 100 ml. I'm talking about the LP little a. And if anybody has a high risk, it's considered greater than 50 milligram per 100 ml of blood. If somebody has 180, it's considered extremely high risk. So here's people who just have increased levels of LDL. If this is a cardiovascular risk, if they have elevated levels of LP little a, and the cardiovascular risk goes up by like 4 to 5 fold. So these patients need to be really, really looked for any genetic elevation of LP little a and take appropriate actions. As I said, it is seen often in the Indian population who have higher levels of LP little a. South Indian patients have been found who have more than 30 milligram per 100 ml of blood have 3 times the risk of coronary artery disease compared to the similar population with the normal LP little a levels under the age of 50. So keeping this in mind, we need to screen for LP little a, especially in the Indian population, because if the cholesterol levels are not really high and if we are having heart disease, this is something that needs to be looked into. What treatments are available for patients with high levels of LP little a? It's usually lifestyle modification, and the last resort is PCSK9 inhibitors, that is evolocumab, that reduces LP little a by 25%. So ladies and gentlemen, these are some of the treatments that are available in managing patients with various forms of cholesterol levels, and the worst of which is the elevated levels of LP little a. And hopefully this has enlightened you as to the various forms of cholesterol levels, what are their normal and abnormal levels, how they increase the risk of heart disease, how you change your lifestyle, and what drugs work best, and what should you expect when you have high cholesterol level. Thank you so much for watching this presentation. It's been a pleasure. I hope this will answer all your questions about high cholesterol and heart disease. And I will see you in the next presentation. Please do subscribe to our YouTube channel. Thank you. Bye.